Welcome to Damal Consult Career Academy. In today's video, we're diving into NHS Band 3 Theatre Support Worker Interview Questions and Answers. If you're preparing for an NHS Theatre Support Worker interview, this video is your ultimate guide to success. We'll cover real-life questions that you're likely to face, along with tips and model answers to help you make a strong impression on your interviewers. Whether you're applying for the first time or looking to advance your career, this video is packed with valuable insights to help you pass your interview and land your dream role in the NHS. Let's get started. 1. Can you tell us a little about yourself and why you are interested in this role as a theater support worker? Thank you for giving me the opportunity to introduce myself. I have several years of experience providing patient care and supporting healthcare teams in fast-paced and high-pressure environments. Throughout my career, I have developed strong skills in organization, communication, and teamwork, which I believe are essential for a role like this. I'm passionate about ensuring the comfort, dignity, and safety of patients during their care journey, and I take pride in being part of a team that works to make a real difference in people's lives. I'm particularly drawn to the theater support worker role because it offers the opportunity to combine patient care with hands-on support to clinical teams in a surgical setting. I understand the importance of maintaining a sterile and organized theater environment, ensuring that all equipment and supplies are ready and available, and assisting the surgical team to ensure procedures run efficiently and safely. This role requires precision, attention to detail, and the ability to remain calm and focused, qualities I have cultivated in my previous roles. What excites me most about this role is the chance to work in a dynamic environment, where I can directly contribute to positive outcomes for patients during some of the most significant and often life-changing moments in their lives. I find the prospect of supporting surgical teams and being involved in the smooth running of theater operations incredibly rewarding. I am also deeply inspired by the NHS's commitment to high-quality care and patient outcomes, and I would be honored to contribute to this mission. Joining the NHS in this capacity would allow me to bring my skills and dedication to patient care to a role where I can make a tangible difference, while also learning and growing professionally within a supportive and respected organization. 2. What do you know about the responsibilities of a Band 3 Theater Support Worker within the NHS? A Band 3 Theater Support Worker within the NHS plays a crucial role in supporting the smooth operation of surgical procedures and ensuring the well-being of patients throughout their perioperative journey. Key responsibilities include patient preparation, assisting in preparing patients for surgery by helping them feel comfortable, ensuring they understand the process, and transferring them safely to and from the operating theater. Equipment and theater setup, preparing and maintaining the operating theater, ensuring all equipment and instruments are clean, sterile, and ready for use. This includes checking stock levels and reporting any deficiencies to maintain a smooth workflow. Assisting the theater team, supporting the surgical team by passing instruments, handling specimens, and responding quickly to requests during procedures. Infection control, ensuring all infection control policies and procedures are followed to maintain a sterile environment and protect patients and staff. Post-operative care, helping to clean and reset the theater after procedures and assisting in transferring patients to recovery areas. In addition, communication and teamwork are essential to this role. Theater support workers collaborate closely with nurses, surgeons, and anesthetists, ensuring a safe and efficient environment for both patients and staff. Also, make sure you check your NHS job description for the specific duties and responsibilities stated there. 3. Why do you want to work for the NHS, and what attracted you to this specific position? I have always admired the NHS for its commitment to providing high-quality, patient-centered care that is accessible to everyone. The NHS represents values that resonate deeply with me, such as compassion, quality, and excellence in healthcare. I want to be part of an organization that makes a meaningful difference in people's lives and contributes to the well-being of the community. As for this specific position, the role of a Band 3 theater support worker attracted me because it aligns with my passion for being directly involved in patient care, while supporting a dynamic team in a critical setting like the operating theater. I am drawn to the opportunity to assist in ensuring the smooth running of surgical procedures, maintaining a safe and sterile environment, and contributing to the overall efficiency of the team. I am particularly excited about the chance to work in a fast-paced, collaborative environment, where I can apply my skills and develop professionally. I am eager to support both patients and the surgical team, and I see this role as a valuable opportunity to make a tangible impact within the NHS. Before we proceed further in this video, let me introduce you to the ultimate resource for anyone preparing for the NHS Band 3 Theatre Support Worker interview. My e-book on the top 50 NHS Band 3 Theatre Support Worker interview questions and answers. This e-book is packed with everything you need to succeed. It covers behavioral questions, learn how to showcase your soft skills and teamwork abilities. Situational questions, master strategies for handling on-the-job challenges. General or introductory questions, impress with your background and motivation for the role. Technical questions, gain confidence in your understanding of procedures and protocols. Hypothetical questions, prepare for what-if scenarios with practical answers. Competency-based questions, highlight your experience and skills with real examples. Case study or problem-solving questions, learn how to analyze and respond to complex situations. And that's not all. This ebook also includes free tips on how to pass the NHS Band 3 Theatre Support Worker interview, plus 10 extra behavioral questions to give you even more practice. It's truly all you need to ace your interview and land the job. Click on the sealer or fourth wall link in the description box of this video to download yours now. It's very, very affordable. To order, head to saylar.co link in the description or click the fourth wall link below. For more details, feel free to chat with our online customer care representative on WhatsApp at 2,348,101,066,191 or send a mail to damilconsult08@gmail.com. Don't wait. Equip yourself with the knowledge and confidence you need to excel in your NHS Band 3 Theatre Support Worker interview. 4. What relevant skills and experiences do you bring to this role that make you a strong candidate? I bring a combination of relevant skills and experiences that make me a strong candidate for the NHS Band 3 Theatre Support Worker role. Firstly, I have hands-on experience in providing patient care in a healthcare environment, where I developed excellent skills in ensuring patient comfort, dignity, and safety. My experience has also given me a solid understanding of infection control protocols, manual handling techniques, and maintaining sterile environments, essential skills for a theater setting. In my previous role as a clinical support worker, I worked closely with multidisciplinary teams, assisting with patient preparation and post-operative care. This has equipped me with the ability to communicate effectively with healthcare professionals and patients, ensuring smooth workflows and high standards of care. Additionally, I am highly organized and can remain calm and focused in high-pressure environments. My attention to detail ensures that equipment is prepared and maintained correctly, which is critical in theater operations. Finally, I am passionate about supporting patients through what can be a stressful time, and I take pride in contributing to their positive outcomes by providing compassionate, efficient, and reliable support. 5. How do you prioritize tasks and manage your time in a fast-paced healthcare environment? In a fast-paced healthcare environment like the operating theater, effective prioritization and time management are essential. I approach this by first understanding the tasks that need to be accomplished and identifying those that are most urgent or critical to patient care. For example, ensuring the theater is fully prepared before a procedure, such as setting up equipment and instruments, takes precedence over other non-urgent tasks. I also rely on clear communication with the surgical team to stay updated on any changes in schedules or priorities. This allows me to adapt quickly and ensure that everything runs smoothly. To manage my time effectively, I break larger tasks into smaller, manageable steps and keep a checklist to ensure nothing is overlooked. Additionally, I stay calm under pressure and remain focused on delivering safe, high-quality care. By staying organized and working collaboratively with the team, I ensure that tasks are completed efficiently without compromising patient safety or care standards. 6. What do you think are the most important qualities of a theater support worker? I believe the most important qualities of a theater support worker are attention to detail, teamwork, adaptability, and empathy. In a theater environment, maintaining a high level of attention to detail is crucial to ensure the operating theater is properly prepared, equipment is sterilized, and safety protocols are strictly followed. Teamwork is equally vital because theater procedures require seamless coordination between surgeons, nurses, and support staff. As a theater support worker, contributing to a collaborative environment ensures that surgeries run smoothly and efficiently. Adaptability is also important because theater schedules can change unexpectedly, and the ability to remain calm and respond to new challenges is essential in a high-pressure environment. Lastly, empathy and strong communication skills help in providing comfort and reassurance to patients, ensuring they feel supported during what can be a stressful time. By combining these qualities, a theater support worker can play a key role in ensuring the theater runs efficiently while prioritizing patient care and safety. 7. How would you ensure that all theater equipment and instruments are prepared and maintained to the highest standard? I would ensure that all theater equipment and instruments are prepared and maintained to the highest standard by adhering to strict protocols and guidelines set by the NHS and the theater department. This includes performing thorough checks before and after each procedure to ensure all equipment is functioning correctly and free of any defects. I would follow sterilization and decontamination procedures meticulously, ensuring that all instruments are cleaned, disinfected, and stored properly to maintain sterility. Additionally, I would keep an accurate inventory of instruments and equipment, reporting any damages or shortages promptly to the appropriate team to avoid delays or risks during procedures. By regularly collaborating with the surgical team, infection control specialists, and maintenance staff, I would stay informed about updates in equipment management and ensure compliance with health and safety standards. I take pride in maintaining a high level of attention to detail, as I understand that the safety and efficiency of the theater depend on the quality of its equipment and instruments. 8. Can you describe a time when you worked closely with a multidisciplinary team in a high-pressure environment? How did you contribute to the team's success? In my previous role, I worked closely with a multidisciplinary team during a high-pressure situation in a surgical unit. We were preparing for an emergency operation, and time was critical. The team included surgeons, anesthetists, nurses, and support staff, all working together to ensure the procedure started without delay. My role was to assist in preparing the theater, ensuring all necessary equipment and instruments were available and sterile. I communicated closely with the scrub nurse to double-check that all items on the surgical tray were accounted for. I also supported the anesthetist by positioning the patient safely and ensuring they were comfortable, while maintaining effective communication to respond to any requests promptly. Despite the urgency, I remained calm and focused, following protocols and anticipating the needs of the team. My attention to detail and ability to stay organized under pressure helped prevent any delays, allowing the operation to begin on time. The patient outcome was positive, and the team commended me for my proactive approach, and clear communication. This experience reinforced the importance of collaboration, adaptability, and maintaining composure in high-pressure situations, all of which I bring to every role I undertake. 9. How would you handle a situation where a member of the surgical team requests something urgently, but you're already attending to another task? In a situation where a member of the surgical team requests something urgently while I'm attending to another task, I would remain calm and professional to manage the priorities effectively. First, I would quickly assess the urgency of the request compared to the task I'm currently handling. If the request is critical to patient safety or the surgical procedure, I would explain to the team member what I'm currently doing and either pause the task, if safe to do so, or ask for assistance from another colleague to ensure the request is addressed promptly. If the current task is also time-sensitive or cannot be paused, I would communicate this clearly to the team member and seek immediate help from another staff member to handle the request. Effective communication and teamwork are essential in a theater environment, so ensuring transparency while keeping patient care and safety as the priority would be my approach. My goal would always be to support the surgical team efficiently without compromising on care quality or procedure flow. 10. How would you ensure the comfort and safety of a patient being transported to or from the operating theater? To ensure the comfort and safety of a patient being transported to or from the operating theater, I would follow established protocols while providing compassionate care. I would begin by confirming the patient's identity and surgical details to ensure accurate transfer and prevent any errors. I would communicate clearly with the patient, explaining the process to alleviate any anxiety, and ensure they feel reassured and supported throughout the journey. During transportation, I would ensure the patient is appropriately positioned and covered for both comfort and privacy. I would check that the trolley or wheelchair is secure and free from any hazards, ensuring a smooth transfer. If the patient requires medical equipment, such as oxygen or 4 lines, I would carefully monitor these to avoid any complications or discomfort. I would also be vigilant for any signs of distress, pain, or anxiety, responding quickly and appropriately. Upon reaching the theater or recovery area, I would provide a clear handover to the relevant staff, ensuring continuity of care. My priority would be to make the patient feel safe, respected, and comfortable, while adhering to all safety guidelines to prevent risks during the transfer. 11. What steps would you take to maintain a sterile environment in the theater at all times? To maintain a sterile environment in the theater at all times, I would follow strict infection control protocols and adhere to the guidelines set by the NHS. First, I would ensure proper hand hygiene by washing my hands thoroughly and using alcohol-based hand sanitizer before and after any procedure. I would also wear the appropriate personal protective equipment (PPE), such as sterile gloves, gowns, masks, and caps, and replace them if they become contaminated. Additionally, I would regularly inspect and prepare the surgical instruments and equipment to confirm they have been properly sterilized before use. During procedures, I would be vigilant to avoid breaking the sterile field by maintaining clear boundaries and communicating with the surgical team if there is a potential breach. After procedures, I would follow proper waste disposal protocols and assist in cleaning and disinfecting the theater to prepare for the next surgery. By being meticulous, proactive, and adhering to best practices, I ensure that the sterile environment in the theater is maintained at all times, prioritizing patient safety and infection control. 12. The theater schedule has been unexpectedly delayed. How would you adapt to ensure everything continues to run smoothly? If the theater schedule has been unexpectedly delayed, I would remain calm, flexible, and proactive to ensure everything continues to run smoothly. First, I would communicate clearly with the surgical team, nurses, and other staff to confirm the updated schedule and identify any immediate priorities or adjustments required. I would use this time efficiently by ensuring that all equipment, instruments, and consumables are double-checked and fully prepared for the upcoming procedures, minimizing potential delays when the schedule resumes. Additionally, I would attend to the needs of patients who may be affected by the delay, providing reassurance, updating them where appropriate, and ensuring their comfort while they wait. If necessary, I would liaise with other departments to address any knock-on effects, such as rescheduling patient transport or accommodating post-operative care adjustments. My approach would focus on maintaining a collaborative and organized environment, where clear communication and teamwork minimize disruption. By staying adaptable and proactive, I would help ensure the theater operates efficiently despite the delay. 13. What would you do if you noticed a potential safety hazard in the theater during a procedure? If I noticed a potential safety hazard in the theater during a procedure, my first priority would be to act quickly and appropriately to ensure the safety of the patient, staff, and the sterile environment. I would immediately bring the hazard to the attention of the senior staff or the lead nurse in charge of the theater. Clear and calm communication is essential in these situations. So I would describe the issue precisely and follow their guidance on how to address it. For example, if the hazard were something like a piece of equipment being misplaced or a spill on the floor, I would ensure it is either rectified or managed swiftly without disrupting the ongoing procedure. If necessary, I would assist with implementing immediate corrective measures, such as moving equipment or cleaning the area, while adhering to infection control and safety protocols. After the procedure, I would report the incident formally through the appropriate channels, such as completing an incident form, so the hazard can be reviewed and measures put in place to prevent it from happening again. This approach demonstrates vigilance, teamwork, and a commitment to maintaining a safe environment in the theater at all times. 14. How do you ensure your work aligns with the core NHS values, such as compassion, respect, and teamwork? To ensure my work aligns with the core NHS values, such as compassion, respect, and teamwork, I focus on applying these principles in every aspect of my role. Compassion guides my approach to patient care by always showing empathy and understanding, particularly in a theater environment where patients may feel anxious. I take time to reassure patients, maintain their dignity, and provide emotional support throughout their journey. Respect is central to how I interact with both patients and colleagues. I treat everyone as individuals, valuing their unique needs and perspectives. For patients, this means respecting their privacy, cultural preferences, and autonomy. For colleagues, it involves fostering a professional and inclusive atmosphere that encourages open communication and mutual respect. Teamwork is critical in the theater setting, where collaboration is key to delivering safe and effective care. I actively contribute to the smooth running of the team by communicating clearly, following protocols, and supporting colleagues, whether it's preparing equipment, assisting during procedures, or ensuring the theater is ready for the next case. By embodying these NHS values in my daily actions, I help create a supportive, patient-centered environment that reflects the high standards of care the NHS is known for. 15. Why do you think attention to detail is critical in a theater support worker role, and how do you ensure this in your day-to-day tasks? Attention to detail is absolutely critical in a theater support worker role, because the operating theater is a high-stakes environment, where even the smallest oversight can have significant consequences for patient safety and outcomes. Ensuring the theater is fully prepared with the correct instruments, equipment, and sterile environment is essential for supporting the surgical team effectively and minimizing the risk of infection or delays. In my day-to-day tasks, I ensure attention to detail by following protocols meticulously, such as double-checking equipment and instruments against the surgical checklist before a procedure begins. I also stay highly organized, maintaining an orderly workspace to ensure everything is easily accessible during surgery. During procedures, I remain focused and vigilant, monitoring the theater environment to anticipate the needs of the surgical team and ensure smooth workflow. After procedures, I carefully handle and account for all instruments during decontamination and restocking, ensuring nothing is misplaced. My commitment to precision, combined with clear communication and adherence to protocols, helps to create a safe and efficient theater environment where patient care is the top priority. Do you have questions for us? Thank you for giving me the opportunity to interview for this role. I do have a few questions. Could you tell me more about the team dynamic in the theater and how new team members are supported during their induction? What are the key priorities or challenges for the theater department at the moment? And how can someone in this role contribute to addressing them? Are there opportunities for further training or development for theater support workers, such as courses or certifications relevant to this role? How is feedback given to team members, and how does the trust ensure ongoing professional growth for support staff? Lastly, could you provide some insight into the next steps in the hiring process and when I might hear back? Thank you for watching this video on NHS Band 3 Theater Support Worker Interview Questions and Answers. We hope you found the tips and examples helpful as you prepare for your upcoming interview. Remember, confidence and preparation are key. Take the time to practice your answers, align them with the NHS values, and show your passion for patient care and teamwork. If you found this video helpful, don't forget to like, subscribe to Damal Consult Career Academy, and hit the notification bell for more expert interview tips and career advice. Good luck with your interview, and we wish you every success in your NHS career journey.